Hello nurses, how are you all, and welcome back to my channel Nurse Navigator Swati. I'm back with the 9th part of Obstetrics and Gynecological Nursing MCQ question and answers. Quickly go through my other quiz sessions, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. From which of the following layers the regeneration of endometrium take place? Options are zona basalis, option 2 zona pellucidum, option 3 zona compacta, or option 4 zona spongiosa. The regeneration of the endometrium take place from the stratum basale or the basal layer. This deep permanent layer remains intact during the menstruation and contains stem cells that rebuild the superficial functional layer each month. Here, option 1, zona basalis is the correct answer. Question number 2. Emergency contraceptives are effective if administered within following period after unprotected intercourse. Options are within 24 hours, 48 hours, 72 hours, or option 4, 120 hours. Yes, you are absolutely right. Emergency contraceptive pills are most effective when taken as early as possible after unprotected sex, but the standard contraceptive pills work best within 72 hours, that is within 3 days. So here option 3 is the correct answer. Question number 3. A sexual pain disorder reported in females is called. Options are anorgasmia, option 2 vaginismus, option 3 Peyronie's disease, or option 4 impotence. Yes, vaginismus is that type of pain disorder where an involuntary tightening or spasming of the pelvic floor muscles around the vagina is occurring when penetration is attempted. It makes sexual intercourse more difficult, though it is an autonomic physical reaction the person cannot control. So here option 2 is the correct answer. Next question. Condom protects from. Options are sexually transmitted infections, option 2 reproductive tract infections, option 3 pregnancy, or option 4 all of the above. Yes, you are absolutely right. Condom protects from STI, RTI and pregnancy. So here option 4 is the correct answer. Question number 5. Which of the following is not a risk group for sexually transmitted diseases? Options are commercial sex worker, option 2 men who have sex with men, option 3 drug addicts, or option 4 person with many sexual partners. Yes, within the given options, the drug addicts is not a risk group for sexually transmitted disease, but they are the high risk group for bloodborne diseases like HIV, hepatitis B, etc. Here option 3 drug addicts is the correct answer. Question number 6. Violet blue discoloration of vaginal membrane is called. Options are Osiander signs, Jacquemus signs, option 3 Hager signs, or option 4 Braxton Hicks sign. Yes, you are absolutely right. Jacquemus sign is an early probable sign of pregnancy which is characterized by a bluish or purplish red discoloration of the mucous membrane of the vagina, vulva and cervix caused by the marked pelvic vasoconstriction and increased blood flow to the reproductive tissue. Here option 2 is the correct answer. Question number 7. Posterior perineal trauma involving anal sphincter falls under. Options are first degree tear, 4th degree tear, 2nd degree tear, or option 4 3rd degree tear. When the posterior perineal trauma involving just only the anal sphincter, it falls under 3rd degree tear, whereas if the tear extending through the sphincter and into the rectal mucosa, it is a 4th degree tear. So here option 4 is the correct answer. Next question. Which of the following characteristics of contraction would the nurse expect to find in a patient experiencing true labor? Options are it occurring at irregular intervals, option 2 starting mainly in the abdomen, option 3 gradually increasing intervals, or option 4 increasing intensity with walking. When a pregnant lady is experiencing true labor, then the intensity of the pain will not be decreasing with walking. It will just increase the intensity. So here option 4 is the correct answer. Question number 9. Vaginal bleeding occurring before 28th week of gestation indicates. Options are threatened abortion, incomplete abortion, missed abortion, or option 4 inevitable abortion. If a pregnant lady is having vaginal bleeding that occurring before 28th week of gestation, that indicates threatened abortion, where the vaginal bleeding with or without mild cramping will occur before 20th week of pregnancy. The cervix remain closed and the fetus is still alive, meaning the pregnancy can often continue normally. So here option 1 is the correct answer. Question number 10. All the following are signs of placental separation and descent except. Options are fundus becoming rounder, option 2 shortening of cord, option 3 small fresh blood loss, or option 4 lengthening of the cord. The 3 unique signs of placental separations are the fundus becoming rounder, there will be the lengthening of the cord, and a gush of fresh blood will happen. So here option 2 shortening of cord is the correct answer. Next question. After fertilization, implantation bleeding usually occurs after approximately how many days? Options are 20 to 28 days, option 2 14 to 18 days, option 3 6 to 12 days, or option 4 2 to 4 days. Yes, you are absolutely right. The implantation bleeding usually occurs about 6 to 12 days after fertilization. This is the time when the fertilized egg attaches to the thick lining of the uterus. As a result of that, it can disrupt and break small blood vessels in the endometrium. This causes a small amount of light spotting. So here option 3 is the correct answer. Next question. Human chorionic gonadotropin hormone is produced by. Options are ESIC, option 2 syncytotrophoblast, option 3 cytotrophoblast, or option 4 decidua. Yes, human chorionic gonadotropin hormone or the HCG hormones is primarily produced by the syncytotrophoblast cells of the placenta during pregnancy, which makes standard HCG during pregnancy to support the corpus luteum and maintain progesterone level. So here option 2 is the correct answer. Next question. Most frequent neurotic disorder in puerperium is. Options are postpartum blues, option 2 postpartum psychosis, option 3 postpartum depression, or option 4 delivery related stress and anxiety. Within the given options, most frequent neurotic disorder in puerperium is postpartum depression, which is a serious mood disorder that occurs during pregnancy or within the first year after childbirth. It mainly occurs as a result of fast drops in hormones like estrogen and progesterone after birth, and also extreme physical tiredness and lack of sleep. So here option 3 is the correct answer. Question number 14. Sudden gush of blood or lengthening of the umbilical cord after the delivery of the fetus is called. Options are placenta accreta, option 2 retained placenta, option 3 abruptio placenta, or option 4 placental separation. Yes, you are absolutely right. Sudden gush of blood and the lengthening of the umbilical cord after the delivery of the fetus is the unique sign of placental separation. So here option 4 is the correct answer. Question number 15. The two pubic bones meet anteriorly to form. Options are symphysis pubis, option 2 coccyx, option 3 sacrococcygeal ligament, or option 4 sacroiliac joint. Yes, the symphysis pubis, it is a non-moving joint located at the front of the pelvis where the left and right pubic bones connect. It uses a thick disc of fibrocartilage to absorb shock and pass upper body weight to the legs. Here, option 1 is the correct answer. Next question. Which is primary sign of labor? Options are abdominal contractions, uterine contractions, intrathoracic pressure, or option 4 pushing by the mother. Yes, you are absolutely right. Within the given option, uterine contraction is the primary sign of labor. Option 2 is the correct answer. Question number 17. Cardinal movement occur before expulsion is. Options are engagement, crowning, internal rotation, or option 4 external rotation. Yes, you are absolutely right. The cardinal movement that occurs immediately before expulsion is external rotation, which follows restitution. During this step, the baby's head rotates externally so that it realigns with the shoulders, allowing the shoulder to fit and pass through the birth canal. So here option 4 is the correct answer. Question number 18. A nurse is aware that the best place to detect fetal heart sound in the first trimester of pregnancy is. Options are below the symphysis pubis, option 2 above the umbilicus, option 3 above the symphysis pubis, or option 4 at the umbilicus. The actual audible fetal heart sound or the tone via a Doppler device is usually detectable towards the end of the first trimester, that is around 10 to 12 weeks, and it can be audible just above the symphysis pubis. So here option 3 is the correct answer. Question number 19. In which condition the umbilical cord is attached to the margins of placenta? Option 1 circumvallate placenta, option 2 battledore placenta, option 3 placenta membranosa, or option 4 velamentous placenta. Exactly. A battledore placenta, also called the marginal cord insertion, it happens when the umbilical cord attaches at or near the edge of the placenta instead of the center. So here option 2 is the correct answer. And the last question of this quiz session is, which of the following lochia findings is expected during the first 24 hours post-delivery? Options are absence of lochia, option 2 a greenish discharge with foul odor, option 3 bright red color, or option 4 large clots with lochia. Yes, within the first 24 hours of post-delivery, the lochia definitely will be present and it will be bright red in color. So here option 3 is the correct answer. So let me know how much you have scored from this video, and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.